I think of diversity in broad terms. It's all the differences, what makes us unique, the differences in all of us. Not just gender, cultural traditions, and race. When we embrace diversity, it really makes us stronger and richer.
Frank is a complex individual who has really done an incredible amount of work in orthopedics. He's also a wonderful mentor, a great educator, and in our residency program, working with him is really a rite of passage.
The number of lives that Frank Sim has touched for patient care and professional inspiration is hard to fathom. Surgeons all over the world are better for having had his experience.
Dr. Sim embodies really what diversity means, to include and train women and minorities and people from all over the world and care for all types of patients. He was a champion for that.
He's wanted to promote and advance orthopedics, and that has caused him to promote and advance diversity within orthopedics.
I grew up in Canada, so there every young boy dreams of playing in the National Hockey League, and hockey is your main passion. So I can remember going to school all through the years carrying a hockey bag in one hand and my school bag in the other hand. So I think I did that most of my life, actually, even after I became a doctor. But there's a point where I had to make a decision whether I was going to pursue a career in hockey, like some of my friends did, or concentrate in the books and go into medicine, which I did. So that made my mother happy. So when I first came to Mayo, I spent a year of internal medicine. And then I was watching all the exciting things my friends in orthopedics were doing. So I went over to a professor of orthopedics and said, I'd like to change into your specialty. So I was never sorry I did that. And it was a very exciting time in orthopedics to development, joint replacement, sports medicine, and subsequently the challenges of tumor surgery, which has been my main interest over the years.
Dr. Sim is quite unique. He never really hard-pressed people how to do things this way and that way. He always stimulated them and convinced them using himself as an example. That works very well.
The enemy of great is good. We're not just going to be good, we're going to be great. And again, he's a coach like the Herb Brookses and not John Woodens. He just is, and that's how great he is. He's one in a million.
Dr. Sim's impact on me has been profound. He's taught me to constantly work to do things better for the patients, constantly seek to involve the necessary team for a specific problem, and constantly try to improve my knowledge of anatomy, of disease processes, and look toward changing the way we care for these patients for the better, and to never think that we've arrived.
I've been doing orthopedics here for more than 4 decades, and I've witnessed the tremendous changes over the years from a very homogeneous type of a practice to now very diverse. Our patients are more diverse, and our practice is reflecting that with men and women working as equals, every race and cultural background. So it's really great for me to be part of that and feel that I've made some change.
He's really spent his career promoting diversity in our profession. And he's done it quietly and without promoting himself. And he continues to do that.